The consumer health industry is actually a very hot industry right now, as many people are engaging more and more about their health. It actually is reaching about $211 billion in 2015, and that's a growth of actually 4% over the previous year. And the way we track consumer health here at Euromonitor is we split it between OTC drugs for treatment. That was worth about $98 billion. Then vitamins and dietary supplements for prevention primarily, and this is worth $88 billion. We have weight management in the era where many people are concerned about their weight, now worth about $14 billion. And most exciting is the sports nutrition that is moving away from the core bodybuilder to more of a product of the masses with a value of about $10.5 billion and an impressive growth of 8% over the previous year. What I find very interesting right now in terms of trends is that consumers are owning their health finally. In the past, the people at the pharmacy or the doctor will actually tell people what to take. Then we move into an era where a consumer could go and ask for a cough remedy or a digestive remedy for their minor symptoms without having to ask the pharmacist or the doctor. And most interestingly, we are moving to an era where we are now merging digital technologies with the consumer. So we're having an empowered consumer in self-care and responsible self-medication, and also a virtual tool through the website or online, and the virtual practitioner who is going to be behind the consumer, so it makes sure that the consumer makes the right decision on the medicines they are taking. We're also seeing a lot of natural healing, and this is a trend based on people becoming more aware about green trends, about what they are taking in terms of clean label. We do track the category of herbal and traditional supplements that it's about worth $36 billion in 2015. Within that theme, we also see that retail clinics or walk-in clinics at pharmacies are becoming an extension of health systems. Health systems across the world are getting stressed with a higher cost of delivering health services. So as a consequence, retail clinics and walk-in clinics are becoming an extension of those systems where governments are seeking new ways of delivering health in the most cost-effective way. So now consumers have the opportunity to go and visit a pharmacy, go to a clinic, or get a consultation about a minor condition that is going to help them treat themselves, prevent diseases, and more importantly, become more responsible in their self-care and self-medication. And finally, we are moving to a trend towards health optimization. This concept has to do with how consumers are engaging in their health, even from a point of view when they are still not showing any symptoms, and how they are paying attention on what they are eating, their physical activity levels, so that eventually is going to help them prevent diseases. And then at some point, if that comes the time that chronic diseases develop, how we are going to take a good care of those chronic diseases so they do not progress even more. So the goal here actually with health optimization is actually to reduce the sick years in people, which right now averages about 11 years in the global population. So instead of being 11 years in being very sick at the end of life, let's try to reduce that to 4 or 5 years. That's the goal.